All right, everyone, is interview time, and we are here with Dr. Ianessa Humbert, also known as Dr. Humbert, also known as Dr. Swallow. Guess what? She's a swallowologist. Have you ever heard of that? Probably not. Chip, have you?
No. Well, now I have because I was obsessed with that title.
That's amazing.
Incredible.
And there's a lot of information. You already heard a little bit about Ianessa in the bio. And of course, this is going to go to like a sexual context because it's shameless sex. And a lot of Ianessa's work, also known as Dr. Swallow. So what Dr. Swallow's work is very much...
it's not about birds, not about swallows.
It's not about swallows and birds, no. And it's not just about swallowing in a sexual context. It's very much also about like the medical side of that. And I'm sure we'll hear more about that and how it also relates to sexuality. So get ready to learn all about oral sex and using your mouth and swallowing and all kinds of fun, and also some things that the whole thing will be things you probably didn't know. So without further ado, let's dive on in. So Ianessa, Dr. Swallow, Dr. Humbert, we're so happy to have you here. Can you please tell our listeners how you got to where you are today as a world-renowned swallowologist?
Absolutely. First of all, thank you both so much for asking me to be on this podcast. I was really excited about the title because I think the key thing here is literally shameless. And I'll tell you guys why that plugs into my profession soon. But let me start by answering your question. My name is Dr. Ianessa Humbert, and my background professionally is in speech-language pathology. Speech pathology is the profession that primarily deals with people who have issues with communication and feeding. And by virtue of dealing with feeding, we deal with everything from premature babies and people with cerebral palsy who have issues with feeding, all the way to people who have a stroke, Alzheimer's disease, head and neck cancer, trauma to their neck, they take medicines, etc., that lead to swallowing disorders. Swallowing disorders mean that you have significant problem getting food from your mouth to your stomach. We primarily focus on the mouth and throat, and then a lot of other disciplines pick up at the esophagus, the stomach, the intestines, etc. So we are the primary specialists dealing with people who have swallowing disorders, also known as dysphagia, which is Greek for swallowing disorders. So I got into this field because I have 3 degrees in speech pathology, my bachelor's, master's, and Ph.D., and I specialize in swallowing physiology and the way the brain controls swallowing. And then after doing that work at Howard University and the National Institutes of Health, I then moved on to do my postdoctoral fellowship at Wisconsin-Madison. Then I was on faculty at School of Medicine in Hopkins, University of Florida, University of Iowa. And then I left academia to create an online platform where I train speech pathologists on how to best treat their patients. And it's like, the best way to describe it is call it swallowing Netflix, but everybody gets really aroused. And I'm like, no, it's so nerdy. It is so nerdy. But we have like over 10,000 subscribers, and it's been great.
Can I just ask real quick, how do you choose to be a swallowologist? Like, how does someone, I've thought about this, like when people are in medical school or like, I'm going to go to medical school, or maybe you didn't even know, maybe it was even before medical school that you figured this out. But how do you say, I'm going to focus on the mouth and throat and be a swallowologist?
Yeah, no, it's a great question. So all speech pathologists deal with generally the mouth and throat and the brain, because we deal with speech and language and feeding and swallowing. But speech pathologists are trained in both of them, whether you're education, so you find them in a school system helping Johnny say S better, all the way to people who are neurodivergent and maybe they have some autism and they have issues with social language, et cetera, all the way to speech pathology related to medical. If you're medical, you're going to end up dealing with a lot of people with cognitive issues, so dementia, and feeding and swallowing, because so many medical things lead or end, that road ends in swallowing problems. And almost every patient we deal with is like, wait a minute, I came in here with a stroke and now I can't eat. Like nobody's walking in there they're like, oh, I might not be able to talk. I might not be able to walk, but nobody thinks I might not be able to swallow. And 15 million people have a swallowing problem. So in 1 year, you swallow 525,600 times. Just like the song, you swallow every minute because you're constantly swallowing your saliva. That doesn't even include your food. And so suddenly you can't even swallow your saliva, and we are the people who step in.
Whoa.
So grateful for you.
I know. I kind of wish that we didn't have to go and talk about oral sex because I have so many other questions. I'm like, whoa. And we probably need a 2-hour podcast because of all of your credentials. I was like, holy shit. Like,
whole series.
Queen, this is amazing to have someone just at your level speaking to us on the level. That's something that is important. Oral sex is important. And I have questions about like the uvula right now and the tonsils when your tonsils get removed, like if that affects stuff.
Yeah,
But we're not there yet. Maybe we'll get there because I do have so many other questions. And also like mouth sleeping, like if you sleep with your mouth open, I've heard so many things that affects like your, I think like your digestion and whatnot. Anyway, but I have all these questions. So maybe I can have a private consult with you about, I'm actually not, I'm a closed mouth sleeper, but thankfully, but I heard like people having to tape their mouth shut.
Or it could change over time.
Or it can change over time.
But anyways, getting back to sex, everyone.
So back to sex, because being a swallowologist, and I'm so impressed with your work that you're doing outside of talking about sex. So thank you for that. But when we're talking about oral sex, particularly deep throating and swallowing, this is something people talk about all the time. They want to know more about. Why are those two things so popular and why are people into it?
Yeah, so a lot of times people don't recognize how important the oral cavity is in terms of the amount of sensation that goes to your brain. Your tongue is like the coral reef of the ecosystem. The coral reefs are the most diverse part of our ecosystem, right? Your tongue has more sensory nerves and more diverse kinds of information that goes to your brain. Think of it this way. If you put something in your mouth that's just a slightly bit too granular for you, your brain will say, ew, 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 gross, and spit it out. If you put it between your fingers, the next possible sensitive place in your body, you might not even be able to detect it. So your body, your tongue and your oral cavity is specifically designed so that you can get all the mouth feels, all the taste, etc. And as a result, sexual experiences follow, right? It's not by accident that we are hardwired to need to eat food that tastes good. And by virtue of that, we end up with nutrition. We generally seek something that is good to eat. And it turns out it has vitamin D. That before humans even knew what vitamins were, we were staying alive by eating things that tasted good. And we used our mouth to explore the world, just like babies do. Adults don't stop using their mouth to explore the world. They just do it with different things. And this is a great example of how we do that.
So did you use vitamin D on purpose right there, by the way? I was like, wait a second.
Sometimes my credentials, it just crosses into other domains, right? Yeah. But yeah, a little vitamin D goes a long way. And so obviously, and by a long way, I literally mean deep throating. Okay. Yeah. So,
that's perfect.
So that's why we have oral fixations. They don't go away, just like anal and everything else. We just replace them with other kinds of things, chewing gum, sucking dick. It's the same idea.
I love that. Yes, this is awesome. I'm so excited for everything else you have to say.
Right? I know.
Well, I've thought about the oral fixation thing too. And I know that some of the things, like when there's like, kids that are thumb suckers, I was actually one of them, but that was more an anxiety issue. That was like
jaw clenching. Is that part?
Yeah,
is that because I have that? I do that.
I do too. So it's called bruxism. And it's just one of the many ways that we sort of manifest anything in our body that is problematic or that we have tension about. Sometimes it's people bite their fingernails, right? Sometimes people flutter their eyes. We are all neurodivergent in a way. It's just the scale of where you and I are is technically socially acceptable. We're not flapping our arms, but humans always do something to make sense of the mental things they can't really cope with. And for me, for instance, it's jaw clenching.
Mm-hmm. Yeah.
Me too.
Yeah.
I do it all the time.
I think I have a newer version of that. Yeah. Thumb sucker as a kid, or like I did a hair twirl too, but like my thumb sucker, or like finger picker. I was a biter. I don't twirl my hair, but I don't suck my thumb anymore. It did pull my upper jaw way forward. And I had to have a headgear and a neck gear. Everyone, I was a really cool kid back in the day. Yeah. I don't even know if they do those anymore. But and then I moved from nail biting and thumb sucking to just finger, like a picking thing of the skin, which I watched my dad, and I'm like, you're doing it too. I'm turning into you. But anyways, not about Amy. And yeah, I was coping. I can look back at it. It was anxiety for sure. Like, and not knowing how to deal with it. And if I pick up my fingers now, I know it's because I'm anxious, sometimes bored. But usually anxious. So,
and sometimes being bored, the absence of stimulation gets replaced with it, and sometimes the excess of stimulation gets replaced with it. So same idea.
So that's why people start smoking, because it's almost that makes sense.
Or like people always need a drink in their hands to sip on.
When I'm at a party or something, I do, and I'll be like, whoa, all of a sudden, because it makes you feel better, or a cup of coffee, or
Okay, we have other questions, but does anyone not have oral fixation?
She said every human.
Everyone has it in some
some
way.
actually have oral aversions, which in a sense is kind of a fixation because you're fixated with not having any sensation, right? So people with oral aversion. So for instance, if an infant is born with no issue to their mouth or neck, but they have a heart surgery. So they're not allowed to take anything by mouth. And they bypass that period where they're doing all that stuff with their mouth. Then you walk in the room with a tray of food and they're throwing up at the thought of food. So then we have to spend so much time trying to get them to be okay with anything touching their mouth, where usually that age, we're trying to get things out of their mouth, but they miss that critical window where oral stimulation and exploration is important.
Wow. Yeah. That totally makes sense.
Total sense.
Yeah. Wow. Okay. Interesting. Maybe that's actually helpful for us because we've met a lot of people who are like not bringing it back to oral sex, and I know that a lot of people are not into oral sex or have an aversion to oral sex or deep throat or something for other reasons, which we're actually going to get to right now. And you're talking about something that could stem from childhood. Which I haven't even thought about. So why do you think so many people have issues with or aversion to oral sex, deep throating, and or swallowing? And swallowing, I'm going to speak to cum of some sort of fluids from someone's body.
Yeah, well, it's twofold. So there is the psychosocial component, which is we should not be doing this. So my whole family is Jamaican, and my parents would say things like, we don't believe in reformed sex is what they would say, right? So we have these old Jamaicans, who's a pastor, like he's 80, like no way, right? So there's a social component to it, but there's also the physiologic component, right? In the same way that someone might have vaginismus or something like that, where their body actually says, and has a protective response. Like, keep this out of it. It's a foreign object. Some people can't even brush their own tongue without gagging. And so some of that lifelong aversion makes them say, I just don't do well with things in my mouth that aren't properly chewed, and I'm super picky that way. They may actually be what we call super tasters, right? So super tasters are people who have more papillae on their tongue. It's a genetic predisposition. They taste more infinitely brighter, right? And they mouthfeel, they can taste and everything, sort of like someone with major perfect vision, like 1620 vision or something like that. So everything's like in HD in their mouth. And so for those people, they might actually really revel in it and be like, oh, I love all the information coming to my body. And for some people, like, I cannot enjoy this because there's so much stimulation in my mouth, right? So because we don't have a great way to test oral sensation in healthy, normal people, the very first time your mouth will ever get tested for its natural sensory index, if you will, is if you have a problem. Right? You go to your primary care physician, they take a tongue depressor, they make you gag, and they go, all right, and they walk off. Speech pathologists do oral testing, but it's because you have a suspected problem. But for the most of us, we don't know how sensitive we are. So it's possible that you got some people, whoever, who's really oral averse, they have issues with just sensation in general. Like, they don't like bananas. A spoon can't be this size, and there's no way for us to know it until they're confronted with a dick, and then they're like, they're the weirdo. It's like, no, you're not the weirdo. You've actually always had this.
Yeah.
Yeah.
Interesting.
Wow. It's mind blowing. So this HD tasting thing is really mind blowing because
you're not steroids.
Have you ever played that game where someone asks you, like, if you had to remove one of your senses, which one would you choose? Oh, yeah. And taste and smell would be so hard for me because they're so related, right? If you are congested in your sinuses or you have nasal congestion, a lot of times your taste goes away and I'm like, oh, I can't taste this amazing.
So April, actually, what it is flavor is a combination of pure taste and smell. If you have pure taste, it is because it's just like table salt, has no smell. You sprinkle it on your tongue, you taste salt, right? If you smell something and don't taste, that is pure smell. It's a combination of that makes flavor. And so when you block one off, you suddenly get either smell or taste. And that's why you're like, I can't taste, but actually you don't have flavor.
Wow. Okay.
So about that, because I think in the back, was it you? I think back in the day when you didn't like putting your mouth on the cock. You didn't.
Well, I had trauma around oral.
Oh, no, I think it was a different person. So they didn't like having their mouth on the cock. So trauma is one thing, of course.
No, I don't think that was.
But they didn't like the actual like skin on skin.
Oh,
thing.
No, that was.
There was something, but like the taste of just having skin in their mouth was like kind of disgusting to them. And that might also just be like from cultural upbringing.
You could solve that with flavored lube if you wanted to solve it.
Yeah. Yep. So you can confuse your senses really quickly. So that's a good tip. So what's different? What I describe with flavor, those are what we call special senses. You know, when you go to kindergarten and they say, what are your 5 senses? And they say vision, smell, taste, hearing, touch. Touch is not a special sense. It's actually balance, and that's located in your ears. Touch is a general sense. It's all over your body. It's vibration, it's pressure, it's temperature. You have that everywhere. And your mouth has more than one. It has taste and it has general. So you can have a cotton ball that has no taste and you can describe it sensation. Some people who have the skin on skin, that is a general sensation issue, has nothing to do with taste. But to your point, you can use taste to confuse the general with the special, right? So now your taste buds are thinking about sending taste information to your brain, and you're not like, ooh, but the skin. So yes, a taste lube would definitely help with that, as well as people who gag a lot because their body's like, this is a foreign object. So if you confuse it to be food, then you can confuse your central nervous system into enjoying it.
So that was a question that we have about the gag reflex. Reflex. Yeah, not reflex. But also you just kind of reassured whenever people play that game, I always say, take away my touch because I'll feel with other parts of my body. And I'm like,
Absolutely.
yeah.
It's like, turn down the radio. I can't see.
Yeah. So I feel good about that. So if you have a powerful gag reflex, which I actually do, I'm one of those folks out there that brushes my teeth. And if I go too far back in my mouth and my tongue, I do start to gag. And with oral, I like gagging isn't that bad a lot of times because it can, it can stimulate more saliva to flow. So what do you think if you have someone that does have a severe gag reflex, should they stay away from oral, or what do you suggest?
So it really depends. Is it psychosomatic? Because you can initiate a gag without any sensation on your mouth. Just the thought of something, you watch a movie, something gross happens, something's touched you, but you're grossed out, so you gag at the thought of that. Some people gag because they need an actual stimulus on their mouth that sends it to their brain, says, hey, we don't like this, please do something, eject it, right? If you don't know which yours is, then it's hard to really say. But at the end of the day, again, confuse the central nervous system enough so that it gets replaced with one thing versus the other, right? Have you guys been lasered? Like, you get your bikini, they have that cold air. That's to confuse you from the pain. So it's not like cold makes the hair come out better or you confuses your hair follicles. It just makes you tolerate it better. So if you're saying for somebody like you, the toothbrush alone is a problem, then you're probably somewhere when that button is pushed back there. You're like, oh, shut the gate. You're probably not someone who's stressing over it. If you are somebody who's stressing over it, relaxation is an important technique, right? So that means that you probably want to engage in things that you naturally are okay with. It doesn't take away your consent. Like some people like to have a glass of wine. Some people need to have a hit of weed or something like that, just because they're like, I would do this anyway, but I make sure I'm strategic when it happens, just like getting an ibuprofen before you start getting really bad cramps. You're like, I'm not going to wait till I'm in the throes of belly pain. I'm starting to feel it. Let me get the ibuprofen now so it sort of coincides with it, right? So it's a matter of when you do your mind relaxation technique, if it's really mental. Now, if it's really purely peripheral, like anything at this part of my tongue will make me gag, then it's, again, confusing different kinds of senses, confusing it with high arousal. The more aroused you are, the less you think of it. So if you are using a vibrator at the same time, you're probably also confused by how amazing it feels. And hopefully that pain-pleasure duo helps you to enjoy both of them. Now you have more sensation, you're more lubed, and a little gagging goes a long way because when you gag, it's a different kind of saliva than what's in your oral cavity. In your oral cavity, you have a thinner liquid, more like water from your salivary glands. But if it comes from the back of your throat in that area, then it's much more viscous and it's intentional because it's meant to get something out of there and slide it out just like a water slide, right? So the idea is that can actually be a barrier between your skin and the skin of the penis. And so as a result, you might not feel it quite as much. So one thing is to really think about what's the source of this. Is it me getting anxious? And sometimes I'm just so easy to gag that if I see something gross, I throw up, in which case you got to get to your central nervous system. Do something to relax. Maybe it's music, maybe it's arousal. But if it's really a peripheral system, like if you touch this part of my body, I'm going to react, then you want to confuse that part of your body.
I love this idea of confusing because we talk about how the brain is our largest sex organ all the time on the show. And so we're working with the brain and it's like confusing, reframing, reprogramming because we kind of are just walking computers working on a program and then we can hopefully learn how to reprogram if we want to, right?
Or neural pathway that's like, yes,
especially if it's feeling problematic. I mean, the extremes, you're talking about folks with like Alzheimer's or something that forgot how to swallow. And then, but we're talking about like the shinier side of like sucking a cock or putting your mouth on a pussy or other bits. And so that's, I like that. I've never heard it that way, though, confusing your brain. And I can think of that in so many aspects of my life where I've implemented something to do that, but I didn't realize it was that. I'm like, I'm just trying to confuse my brain right now. And let's make this a game.
Yeah. So also let's not forget the fact that when somebody has an issue with providing oral sex to somebody with a vulva, there's nothing back there that's triggering that. Because then you couldn't even like touch your teeth for fear of gagging. And the gag reflex is not going to be that forward. It's going to be when your tongue starts to curve and there's danger of something going over the cliff, if you will. That's when it's like, whoa, 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 danger. But at the front of your mouth, you don't gag. Otherwise, you couldn't put a glass to your mouth without gagging. So if that is your issue, it's generally psychosomatic, right? It's this idea that, ooh, there are smells, there are sensations, there are things I don't like, in which case those individuals are, a little bit more ashamed because they don't want to turn their partner off because that's like, ooh, I'm grossed out by it. Whereas a lot of people who own penises, they're kind of turned on, like, yeah, I made that person gag. It was so big, blah, 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 right? So it's also important to be mindful that sometimes the gag reflex can interfere with the sexual nature of something such that you feel like you're saying you're turned off by somebody and you're not. Your body just is trying to figure it out.
Mm-hmm. Oh, God. Can we just hang out with you all the time? I love it. I know you're busy. And so a lot of your work, you have this other side that you're working on, which is with the sexual side, but a lot of your work is kind of more of like the science, the research behind that. So before we do more on the fun sexual side, let's talk about the science of swallowing. So what are some key points that we should know, our listeners should know about how it all works from your perspective as an expert in swallowing or swallowologist?
Yeah, sure. So essentially the goal of swallowing is to ensure that you get things into your stomach that will keep you alive, right? Be it fluids or be it food. That everyone kind of understands that. But really what's important is that swallowing is a weird process where you're both taking things in and keeping things out at the same time. So you probably swallowed something went down the wrong way, right? That wrong way is only the wrong way for a second. Other than that, it is your breathing tube and you want it to be open. It's basic to your larynx and your trachea. Your job is to get your food into your esophagus and your stomach. And so there's a very tight coordination between closing things off that don't go down the wrong path while opening things up that should go down the wrong path, the right path. And so that is usually the critical thing about swallowing that people don't understand, that 99.9% of the time, people who swallow normally do it perfectly, except for those 2 times when you're on a date that you're like really embarrassed by and that like, the champagne goes the wrong way and you're like coughing like crazy. And you remember those because they're so like flagrant, right? So swallowing is something that you should take for granted. You should not be thinking about it. It is a background activity that you don't want to think about. And then when it's a problem, it's all you ever think about. Yeah. So that, as I said before, you swallow every minute. You're swallowing saliva all the time to just keep your system moist. It's like blinking to prevent corneal dryness. You blink all the time. Then suddenly you can't blink and that's all you can think about. In fact, if I say, don't blink, you're like, I must blink now. Same thing with swallowing. Don't swallow. Like suddenly every bit of saliva must be swallowed.
I just swallowed because you said that.
Yeah, exactly. It's
like yawning. Yes.
Yeah. It's like I never tell people what I do over Thanksgiving dinner because suddenly I'll have 10 clients. They all have swallowing problems on their next bite.
Oh no.
You're like planting the seed in their brain without trying to do it.
Yeah. No. Billionaire forever.
Yeah. Oh my goodness.
Yes.
Yeah.
That's
wow. Incredible.
So it's, oh my God. Okay. There's,
once the brain gets online, you're kind of a little squeaky. So I have tinnitus now since late February. And so I've gone to ear, nose, throat doctor, mouth, throat.
Yeah.
Anyways, so they're like, so constant ringing in one of my ears after some sweat and hot Pilates dripped in my ear just suddenly happened. Anyways, they're like, once your ears hear it, you're like your brain, or once your brain notices it, it's really hard to unnotice. And so it's like a process of habituating to it, and it might go away too. But you're talking about that with swallowing. It makes sense. Like the minute you notice, and so bring it back to sex, but also not. So we were doing the research side of it, or the more the medical side. Once you notice I have a problem swallowing, then your brain kind of gets stuck on it, and then it becomes a problem because so maybe you didn't even have a problem to start with.
No, go ahead first because I want to say something about when. Yes, please, Ianessa. Because
like, no problem. No, so basically, your body is filled with functions that it doesn't. The lower parts of your brain just want you to get out of its way. The higher part of your brain is like, what y'all doing? What y'all doing? I'll just fucking shit up all the time, getting in the way. And the lower center is like, we got this. We know how to breathe without you. We know how to blink without you. We have all of our reflexes in place. And once your cortex gets involved and starts messing around with the brainstem and stuff, then now it's overthinking everything that it was doing in the background, right? And swallowing is a reflex. Gagging is a reflex. A lot of things that we do are reflexive and they need to be there. That way, if we pass out, we don't stop breathing. In fact, oftentimes kids are like, I'm going to hold my breath. And it's like, go ahead, little Johnny, because your brain's going to kick in and you're going to wake up over here and you're still going to eat that damn broccoli. Go ahead. Hold your breath. I don't care. It's like once your mom's a neuroscientist, it's like, Okay.
Yeah, you're gonna eat that broccoli.
You're
Yeah.
fucked. You're
Eating the broccoli.
Yeah.
Absolutely.
I just think about this because it is so the psychosomatic piece of it. I think that you said, Dr. Humbert, so I've been like with new partners, for instance, where they were sleeping and I was like, don't swallow. They're going to hear you swallow. Then it looks like you're nervous. And I got in my head and then I was like, I'm going to swallow. Oh no, I'm swallowing. And then I'm like, I'm going to swallow again. Oh, they can hear everything. And I'm like, it's like this mind fuck. And I go into this cycle and I never knew how to get out of it because I just thought, well, maybe I'm just nervous, but they could hear everything. But I love the fact that it's a reactive, I guess it's a reaction. It's a reflex. So it's like the knee tap and your body reacting to that. Yeah.
You're just too highly focused on it. I've totally had that same
Have you had that? Okay, good.
100%.
Have you ever had
many times?
Dr. Humbert, please tell me
Yeah,
that. Okay,
everyone does. In fact, to your point about the knee jerk, when you go to a physician and they hit your patellar tendon, which they're the part of your knee that they want to stretch to see if you have that reflex, they usually ask you a question because now that you're staring at your leg, it's not going to work because your stupid higher center brains are like, he's going to hit it any second. It's coming. And then it doesn't work. It's like, oh, so where do you work? Bam. And then you're like, ah, shit, you got me. And they have to do that to separate your two systems that want to fight.
Oh, okay. Wow.
And that's why arousal, to your point about the brain, it starts between your ears. When you can get between my ears, you can get between my legs. That's the way it is. If you can get my brain to focus on the parts that matter and not be anxious about having an orgasm or anxious about gagging or anxious about anything, then we can calm down. And that's often why women sometimes can take longer to get around to it, not just because blood fills up more slowly in our clitoris, but also because we're often in our head.
Well, I second that and third that because I know I am. So that's a great tip. And that's our listeners love tips and tricks, especially when it comes to oral. I can already tell this episode's going to be a really good one and people are going to love it. So what are some of your top tips besides that one? Because that's an excellent one for how people can up their oral game, if they want to up their deep throating game or their swallowing game or all three. What do you suggest on top of those pieces?
Right. So one thing to remember is that we've already talked the gag reflex. Let's talk about when gag is not an issue anymore. A lot of times what the body needs is it needs constant stimulation, but it needs some variable stimulation, right? So if you take any part of your body and rub it exactly the same way over and over, your body starts to habituate to it, just like you were talking about with your hearing. And so what happens is you don't even feel it anymore. I don't feel the socks I put on this morning. You know why? Because my brain is smart enough to not think about it so I can go and have some breakfast, for fuck's sake. Like if I'm stressed about my socks, then I have OCD, right? So what you want to do with the oral cavity is you want to apply as much variable sensation until, of course, they instruct you to keep doing that because they're close. But until they're close, generally, it's the variable kinds of stimulation that leads somebody to arousal faster, right? Your brain's wired to detect change, not to detect the same thing. That's why until something flashes before your eyes, you don't even remember where you are. Like, oh shit, where am I? You need change. And then that constant information of change often lets the brain realize, oh, I'm really tuned into this warmness I'm feeling now. So that's one important thing.
Okay.
The other important thing is that if you're not aroused by it, the enthusiasm may not transfer to your partner. A lot of times seeing somebody who's basically ravenous for you in an oral sense gets you excited to the point where you're like, holy shit, I feel like I'm watching porn, but it's on me. This is so weird. You know what I mean? So a lot of times people talk about the fact that enthusiasm it's just like infectious. You know, you see a bunch of people laughing, like, why are we laughing? Why are we laughing? Because your brain wants to be involved in what other people are doing. There's something called mirror neurons in your brain, which when somebody else is doing something, the parts of your brain that would be involved in doing it are active, even though you're not doing it. So if you see somebody jumping or walking, the parts of your brain that would be involved in walking partly are involved. So if somebody's actually really aroused and excited, and they're not just like, when's this going to be over? Then you're more likely to get involved. So enthusiasm is the best thing to do. Forcing oral where you don't like it is like, me eating beets. I can't stand beets. I keep wanting to like them. My body doesn't like them. I've given up on beets. Some people might want to give up on a form of sex that they just don't like. And because oral sex has this sort of risque thing to it, people sometimes feel like they have to like it to be sexual beings, and they don't have to like it. They can probably learn to like it if there was less pressure to like it. But in the current context that it has to be done, or else you're not a good sex partner, you may never, because then the anxiety comes in, right? So if you find yourself creeping towards somebody's genitals with your oral cavity because you just want to be there, they're probably going to sense how much you want to be there. So give yourself time to enjoy it the way you want to and be less performative and more pleasure centered.
Mm-hmm. Hell yeah. And if I had trauma, which we talked about a little bit, which I'm not going to get into that deeply, but I had trauma around someone forced me to give them oral when I was 15. And so it was really hard for me because I would get back into that space, and I want to speak to anyone out there. So I would be pretty refusal. I would refuse anyone for years and years until I felt safe enough with them. And I felt comfortable enough that I was not going to be, I guess,
violated. That's a violation.
Basically to be completely violated.
Like, it really is.
It was.
People take it lightly. Like,
it took a while. And I was wondering if I would ever be a person that just wouldn't give oral. And so I don't want to tell anybody what to do out there. I will say, though, if there is a time and a space where you do feel safe enough to ask, maybe you can just dip a toe in and see how it feels, and then take it day by day from there. That's what I did. And
maybe that's a practical tip. Maybe you are just dipping a toe in their mouth. Maybe it's about a non-sexual thing in somebody's mouth. Maybe it's a finger. Maybe it's an earlobe. Maybe it's a toe. Maybe it's something. It's like, okay, I can work my way over to something else.
I love that.
Again, it's about confusing the central nervous system, because you want to be there, but you're like, why can't I let go of what happened to me? Because as you know, trauma lives in the body, and it's our job to relearn coping strategies. That same powerful brain that got you to the place where you are averse to something is the same powerful brain that can walk you away from it. But you just have to give yourself time and permission to do that.
Mm-hmm. Yeah, that's and then, well, actually, we're going to get into this later. Was there a couple? I think you said there was 4, or did I misinterpret that? The tips you wanted to share?
No, there was something I was going to add to variable practice. And one thing is that it's not just about, because there are parts of your under your chin, it's called the submental area. It gets very sore. Its job is to both hold the tongue in a position while opening your jaw and moving parts of the bones in your neck, known as the hyoid bone. When that part of your mouth is very active, you can get tired quickly, right? And so oftentimes people don't realize how much using their hands helps the partner. When the penis is very wet and you come off for a bit and you use your hands and then you go back with your mouth, they're getting that variable sensation, but also you're giving yourself a break in the process. And there's nothing wrong with that, because the nervous system likes that variable experience. So that's just another tip for keeping the oral cavity from being super stressed and such that you can't really enjoy it because you're kind of in pain.
Yeah. Yeah, that's interesting. There's so many like interesting key points here, and I like that you said. So that's something that we've also referenced as well. And like obviously we need to like take a break, press pause, slow down if our bodies are in pain, and then because we're distracted by them. Now we're not being present, which is kind of one of our best sex tips over here. Is like show up for the event, emotionally and energetically. And so many of us, I think most people, have been distracted during sex a number of times, if not 5 billion. So there's the part of like, it's okay to press pause, slow down, say, hey, I'm really uncomfortable, so I can like come back to this. And a lot of times, like head, neck, throat, mouth, all these things. I mean, this is why we don't recommend any numbing sprays or lubes for oral.
Please don't. Actually, it's problematic because what you're doing to those nerve endings is you're telling them to turn off artificially. It's much better for them to be in place and it's sort of like sunglasses versus let me just jab my eye because the sun is too much. Why would you? Don't touch your eye, just mask it, right?
Yeah.
That's the difference. And in fact, those nerves need to be in place for when there really is some protective response. The reason you gag or can swallow is because sensory information was received that needs to be responded to. You are now blocking the body's capacity of sensory information both during sex and non-sexual activities where they need to save your life and literally save your neck from a foreign object. So you don't want to condition those nerves to the point where they can't function for a life-saving behavior.
Yeah. And the same goes for anal, everyone.
Yes.
Numbing the ass. If you're going to do any anal play, don't numb it. And you're doing it because you want to have an experience, right? So be there for the experience, or don't do it. But your body needs to be able to tell you if something's painful.
When is numbing good? Except at the dentist, is it good?
Oh yeah, for those kind of things, surgery.
Because I'm curious. Yes.
Yeah. So there can be all kinds of reasons why topical anesthetics are useful, or injected ones, and they're typically for procedures. Some people have a cold sore, and you can go to CVS and they have a little bit of a numbing agent on there for that, or like a canker sore. They do have a little bit, but the amount that you'd be using in your throat, where those sensitive aspects are, is really quite different. Now, on that note, when we talk about this, the other thing to remember is that, first of all, let's talk about deep throating and this idea that the space between your lips, let's imagine your mouth is crammed right into this person's abdomen. Like your lips are practically on this person. Even an erect penis doesn't go all the way from the level to your lips think about how far back your throat is, right? You're beyond 6 inches. Okay. And then somehow the tip is going to turn 90 degrees down into your neck. What you're doing is you're jabbing that area. It's not like it's turning down, right? So when we do oral screenings and dental hygienists do, we can tell who's had recently because there's bruising back there from all that jabbing.
No way.
Absolutely. Yeah, you take a pen light, you can see their soft palate, or they're just behind that, the posterior pharyngeal wall.
They know everything about it.
I mean, we don't say anything. It's shameless sex podcast, right? We want to be, we're here to clean your teeth. We're not here to I'm
gonna go give a blowjob every time before I go to the dentist.
Yeah, but seriously, you just go on Amazon, get a pen light, and you can track your own progress, and you can actually see where things are actually hitting up against. And remember that there are things called throatgasms, right? So for some people, the reason they enjoy it so much more is because they have that craving, because the same nerve that innervates the lower parts of your body, the vagus nerve, has to pass through your throat. It also gets sensory information and tells muscle to move in your voice box, your larynx, and in your throat. It's the same nerve. It just branches off differently. So there are many women who've had like spinal cord injury. They don't have any sensation below the waist, but they experience orgasms at the level of the throat. So some people actually have that kind of wiring where it works. So the numbing can sometimes keep you from having those experiences because you're just trying to block it all off. And maybe you're somebody who could experience pleasure.
Yeah. Wow. Yeah. That's just so insightful. And then the throatgasms we've talked about too before, about like, was the movie Deep Throat, which was like highly traumatic for the actress that was involved in this. But I think you get confused because you're saying it's not all people can have throatgasms, although because the brain is our largest sex organ, we could probably do a lot of work to reprogram to have an orgasm via something in our mouth or, touching our throat. Just like, people can learn to have armpit gasms and nipple gasms and
belly buttons.
Yeah. Belly gasms. Toes. Yeah. I have an orgasm from April just touching the inside of my hand. So, but when it usually doesn't happen overnight, it can take work. So I love all of this, like this variety here. So I would like to just bring it to something a lot of people who are listening are probably like, oh, I'm really wondering about this. I want to bring it to jizz and come. Because we did talk about like an aversion, the skin on skin, or maybe something being in your throat and the gag reflex. But what if I just don't like cum in my mouth? Like something about the taste, the feeling of it in my mouth, or the swallowing part of it, like something about it going in my stomach grosses me out, or something like what do I do with that? What is that all about?
Well, so there are a couple things. One is that it doesn't necessarily, it tastes like bodily fluids, right? It's just like anything else. Some people like to swallow pee. We all used to swallow pee. That's what our amniotic fluid is. So anyone who says they didn't swallow pee, they're lying, because in order to be born, you had to have swallowed pee. You pee and you swallow, and that's called amniotic fluid. Now, afterward, some people actually enjoy tasting other people's urine, right? It's really just a matter of what you enjoy. If you don't like cum in your mouth, you have a couple of options, which is tell your partner, don't come in my mouth. Like, tell me so I can get off of it and I'll finish you with my hand or whatever you need to do. The other option is to take it in the back of your throat. If you don't have a problem swallowing it, you just like to want to taste it. If you take it in the back of your throat, then what will happen is you will have what we call an irrepressible swallow. And I've studied this at Hopkins, where I would actually put tubes all the way to the back of someone's throat and X-ray video, squirting it right to the back of their throat. And every single person has a irrepressible swallow response. And the amount that I squirt is almost exactly the same amount of cum. So it's about a teaspoon, like 5 cc's of, we call it barium. It's white, looks like milk, very similar, right? If you can take it in the back of your throat, you never taste it. It goes right back down. If you don't care about it being in your stomach, you're fine. If you do care, then you're a spitter. There's nothing wrong with that. And if you don't want to taste it, then don't take it in your mouth at all. The reason I don't like the idea of people having something else in their mouth at that time, like, oh, put a sugar lump in there. Your body is so trying to manage too many things that might actually slip back and now you're choking on something. So just make the decision to not have something in your mouth besides the penis. And your swallow reflex will do its job if you haven't been numbing, and it can take the sensation.
Yeah. And I think there are things like dietary wise that folks that are having ejaculate, not all the time, but that can change the viscosity and the taste of your ejaculate. So that is a possibility. Be like, yo, you need to have more wheatgrass.
Yeah. And there are people who are allergic to cum. So, and the reason I know this because an allergist professional conversation I had, she talks specifically, she has the man, like some women will say, this actually, I think it's a semen. So they take a sample of the semen and then they send it to the lab and they do find, okay, yes, you are actually allergic to it. So what they do is they actually recondition just like any other allergy such that she can enjoy it. So there is a process for that. If you think you're allergic, you need to go to an allergist, but there's a process for managing that too.
Then you have tiny doses of your partner's cum.
Yeah,
you're
like microdoses.
Yeah. You're like, okay, because you're building up the tolerance. That's what they do for kids with peanut allergies. Yeah. They'll give them tiny, tiny little fragments. That's what the indigenous folks did with on the West Coast for poison oak. Yeah. You would drink it in your tea to slowly have your body build up an immunity. Yeah, so that went the opposite direction on me with honeybees. Now I have an allergy because I've been stung so many times.
Yeah, everywhere we go, I'm like, do you have your EpiPen?
Yeah.
I have a question. It's just like total sidetrack, but it's still about jizz. You've heard the thing about how it's good for your skin? Have you heard?
I've heard that.
Which I'm like, a whole bunch of penis owners created this so they can come on some.
It's because they want to make a new spa for facials in a different industry, and I oppose it vehemently.
Yeah, so you've never heard or seen anything that's like legit about it being good for the skin?
I don't know. I mean, people just be saying stuff. You know what I'm saying? Like,
I
mean, why
not?
Your
face,
I mean, but the thing is, if people used to put egg whites on their face as masks, right? So, I mean, if it works for you, do it.
I've heard like mayonnaise. I have sensitive skin. I break out easily. So I'm like, hell no, do not ejaculate anywhere. You can on my tits, fine. But not the face. Okay. Not the eye.
Well, it's a little crusty over time too. You're like put on your skin, all of a sudden it's like people like flaky.
Exactly.
Different strokes for different folks. You do you, everyone.
So
both literally and figuratively.
Exactly.
Yes, exactly. So, okay. Tell us about, there's something called the Gulp Group. Okay. So tell us more about the Gulp Group. I'm assuming it's an acronym for something.
Yeah, it stands for Gaining Understanding About Lovemaking and Physiology. And I created Gulp with my best friend, Reba the Diva, Reba Thomas. She had a meeting called Sexology Summit here in Washington, D.C. She has a top fellatio class in D.C. So when you're a swallowologist and your best friend's a sexologist, you have to do a show. Like, you don't have a choice. So that's our show. And what we really love about it is the fact that I can nerd out and give all the physiologic things, and she tells me all the sex stuff. And we end up, we don't have a yuck factor, right? So whatever somebody wants to talk about, we love. But we also get the opportunity to explain things from multiple lenses. And that's why it's been such a great experience. I've learned a ton, and so has she. And so, we've been together on a lot of podcasts, but also we end up having this experience where people send us messages all the time asking, hey, on your show at time 1342, you said blah, 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 blah. And then I have to go back and see, what did I say? And then try to interact with the person. And we find that we get a lot more questions about sex and sexuality, just like on the Oprah Winfrey show, not the Oprah Winfrey show, but on Love and Marriage. That happened because people felt like, oh, I feel like I can ask her this question in front of the United States.
Yeah, you do help people feel comfortable. At least you help me feel comfortable. And I feel like Amy can probably agree. So Gulp Group is on anywhere podcasts are listened to, or is it on a specific platform?
So it's on YouTube. Yeah.
It's on YouTube.
You go to YouTube and you just go type in Gulp Group, then you'll see the show is there. And so it's just us live in living color talking. Well, not live, but in living color talking about various things related to sex and sexuality. We have guests, etc.
Yeah, definitely. We'll check out the Gulp Group. Oh, I don't really want to say goodbye to you, but that's rude because I know you have a life and you're a very busy human.
Yeah.
And I just want to express my gratitude for being on Shameless Sex and sharing way more information than just oral and swallowing. And I learned so much about, I think, just the physiology of things in general that happen with the throat. And I probably will look at people swallowing for the next few days. I'm not going to lie. I'll be like, how are they swallowing? How are you salivating? So
that go down, sir? How'd that go down?
Yeah. So can you tell folks about your other offerings outside of Gulp Group, as well as how they can find you or work with you? Anything else you have exciting on the horizon?
Both involve my first and last name. So IanessaHumbert.com is where you can find a lot of basic things about swallowing disorders. Patients, caregivers, clinicians, that's the best place to go. If you want to talk to me about career consulting, a lot of speech pathologists now want to talk to me about, well, how do I get involved in sex and sexuality? Or if you are in need of intimacy coaching, then it's IanessaHumbertConsulting.com. So one is a more professional thing for clinicians, for people with real swallowing disorders. And the others are for us who don't have a swallowing disorder, but want to talk about issues around swallowing and
nice. Wow. Well,
oh, wait, one last socials.
yeah.
Socials? Do you want me to follow you online and stalk you a little bit?
Yeah, on Instagram, it's again, first name, last name, Ianessa Humbert. I'm the only one on the planet, so I was like, why be fancy? And so you can find me there on Instagram. And there's a lot of, and Gulp Group also has a page. So you can find us there and see some of our videos, some of our tips. It's all there.
No doctor in front of Ianessa Humbert, though?
No.
Well, you like this?
Thing.
I was born with Ianessa. Yes.
Well, when you're a world-renowned swallowologist, like you don't need a doctor.
Yes. I didn't think so. However, it's just always impressive because you have such an incredible laundry list of accreditation. You are phenomenal, and I really can't thank you enough. So thank you, Ianessa. And to all of our listeners out there, the Shameless Sex Revolutionaries, I love you. I know Amy does too. We cannot be more grateful for each and every one of you that listen every day. We do drop a new episode every Tuesday. And I just want to encourage you, invite you, if you haven't done so, please rate us on iTunes and Spotify. It just helps more folks. This is a free resource. It helps more folks out there find Dr. Humbert, people that are helping people all over the world not only swallow better, but that just have information about their bodies that folks can't always access for free. So this is a resource for all of you anywhere, hopefully that you can listen. And my love goes out to each and every one of you. So thank you.
And we love 5 stars. And if you don't have time to write a review, just put like a squirrel emoji or like a squirt emoji or a pickle. I don't know.
Put an O face emoji, the little head with the O. Yeah. I like those.
That's good. Yeah.
And yes, that's all we have this week. And we will see you next Tuesday for another episode of Shameless Sex, y'all. Ciao for now.